All right, so this is my presentation on foundations of behavior, RBT skill development, and basically what it's going to cover is I try to keep it short, simple, just so that it's engaging for anyone who's going through this kind of onboarding or training structure. But basically, it would include the introduction, describe the role, basic responsibilities, important parts of the responsibility of an RBT, kind of covering socially significant behaviors, collaboration with your BCBA or BCABA, and then obtaining help and communication with your BCBA is what it's kind of going to be like the little components. Basically, with the role overview, I think it's just important to kind of discuss whether it's a new RBT or someone that's been in the field for a minute, just because it's always important to kind of clarify your responsibilities as an RBT because you do play a really important role as far as implementation and data collection, and it really helps guide the intervention process. So sometimes just kind of going over that and just kind of really defining that importance of that role so that we all know and like an issue doesn't come up later, whereas because of a lack of communication or lack of understanding. But basically, as an RBT, we're here to kind of focus on those significant behaviors and reduce maladaptive behaviors and kind of just make sure the client is safe, you're safe, and just that reduction of behaviors and also simultaneously working on skill acquisition. Um, it's really important as an RBT to collect accurate data. Again, this is something that should be discussed for the most part in onboarding because the data collection is what guides the behavior plan modifications. That's done on the BCBA or BCABA kind of side of things. It's important to deliver skill acquisition plans accordingly, reviewing the different steps and the guides and the programming, depending on the program being used at the site. Basically, like not collecting data for skill acquisition goals that are being run incorrectly, or if you're not sure how to run it, just kind of take notes and when during your supervision, kind of communicate that to your BCBA because I feel that it's preferable to not collect inaccurate data and skew the data versus collecting data for something that you've already been trained on, had it modeled, etc. Just for accuracy purposes. And socially significant behaviors is something that I also included in this presentation because socially significant behaviors can vary from family to family based on the age or deficits of the child. But mostly it is going to vary from family to family because what's socially significant to a family that maybe attends church services on Sundays might not be as relevant to a family that has a 14-year-old child that is going through puberty and a lot of changes that they need more support in managing to help their child become more independent in their daily living skills versus the first family might have an emphasis on wanting to be able to sit through service with their child. Maybe their child is 4 to 5 years old or nonverbal, gets antsy and doesn't really like sitting through service, and that's something that might be relevant for them. So this is going to differ, but this is something important for RBTs to know because maybe they notice things when working with clients that might be relevant and also relatable as far as socially significant based on their age or things that have been observed during session. And this just kind of piggybacks off that as an RBT, the role that we carry is really significant. And it's just important to remember your role, what we're here for, and we're here to provide quality services and ethical services. And we're focusing on teaching new skills, but that are relevant and socially significant to the child or the adult or the individual that we are working with and their families. Collaborating with your BCBA is super important because we're kind of their eyes. As an RBT, you're kind of the eyes of the BCBA. You're first hands implementing everything, seeing what works, seeing if maybe a certain skill acquisition is just not working in the sense of maybe it's evoking behaviors when you're working on imitation. Just for an example, when you prompt them with a gestural prompt or maybe a partial physical prompt at the elbow, and then your client starts engaging in maybe a new maladaptive behavior, anything that's new or just noticeable as a response to an intervention that we're implementing, it's super important to kind of mention that to your BCBA and remember that at the end of the day, we as RBTs are collaborating with the BCBA, but we're also collaborating with the client and their families. And it's really this whole team and support system for the benefit of the client, for them to have that individual, that advocacy to live their best life. And at the end of the day, to fade services, because the goal with ABA is not forever. It's to eventually fade the services that we provide to our clients. And help in communicating with your BCBA included in here, because it's important to have close collaboration with your BCBA. And it's just not only to make sure that we're implementing things the way they need to be implemented, but if we need support, if we're overwhelmed, or if maybe we have too many skill acquisition goals that we cannot collect data for, anything of that sort, it's really important to communicate these things to the BCBA, because sometimes it might look really nice on paper, but doing it maybe in a 6 hour session could be unrealistic, depending on how demanding or exhausting it can be on the RBT. I included a Q&A recap, but I also was thinking that either before like starting this presentation, it would also be nice. I feel like when starting an onboarding presentation of this type, it would be interesting to kind of have what I included in the clinical toolkit, which is like a staff questionnaire and profile, kind of to understand where this person is coming from, or whether it's a group of people doing the onboarding, a little bit of their background as far as an RBT. Are they new to the field? What are their personal experiences? Maybe they had tough moments. How did they resolve that? I think that's something else that was included in the toolkit that would be relevant and helpful. Would be the diagram image that I did about resolving conflict, just kind of knowing the processes for that, so that we just don't think that there's no solution for it, that there's like a hierarchy of what we could do if we need more support as an RBT. And also I think that it would be nice to include the cultural humility, like how have we been presented with opportunities to practice cultural humility based on the different kinds of clients that we work with, because they do vary. But yeah, so that's basically my onboarding presentation and just a few notes of what I would use from the clinical toolkit that I think would be relevant to include in like this kind of training that I think would be really helpful to new and older RBTs alike, just kind of as a refresher and just kind of to remember, I guess, if that makes sense, the importance of what we do on the day to day, and then how at the end of the day we are all doing this for our client and per board standards, and we don't have to do it alone. Maintaining support with our BCBAs, at the end of the day we're all collaborating and with all the same common goal.